Welcome to a special episode from our Beyond the Roundup series. Today we'll be talking about the disturbing treatment of the doctors who were presenting on Ivermectin to the Senate Homeland Security and Governmental Affairs Committee by Ranking Member Gary Peters in his opening statement before these professionals even had a chance to speak. And in this episode, we'll also hear from Dr. Kory of the FLCCC, or the Frontline COVID-19 Critical Care Alliance, who was part of the group of doctors speaking at this hearing, who I was able to speak to by phone to get a statement about this unfortunate outburst by Senator Gary Peters. All of this starts now. So, on Tuesday, the Senate Homeland Security and Governmental Affairs Committee heard from medical professionals who advocate for alternative coronavirus treatments and mitigation measures than those at the National Institutes of Health, Centers for Disease Control and Prevention, and the World Health Organization. Now, several of the doctors, based on growing evidence, advocated for the use of the drug ivermectin to treat patients. Now, after Chair Ron Johnson's opening statement, Ranking Member Gary Peters delivered his opening statement, and with apparent shamelessness, criticized the hearing, besmirched the dedicated physicians as political in an appalling assault on not only the doctors, but also the accumulating scientific information backing ivermectin, even going so far as to accuse the doctors of undermining the vaccine and discouraging social distancing and masks. Take a look.
The panelists have been selected for their political, not their medical views. The witnesses have made many harmful inflammatory statements. Those statements include undermining a COVID-19 vaccine, discouraging common sense measures to stop the spread of the virus like social distancing and masks. And sadly, today's hearing will not provide accurate scientific information or advance any useful efforts to slow the spread of the coronavirus pandemic.
Now, folks, Senator Gary Peters' statement here is simply not true. In fact, for Doctor Pierre Kory and the Frontline COVID-19 Critical Care Alliance group, they promote social distancing and masks as part of their recommended eye mask protocol. Literally, it's in the name. As an example, the press conference put forth by the FLCCC on December 4th, just days before the Senate meeting, spent a number of minutes talking about the importance of social distancing and masks. Take a look here.
It's very important to wear masks. Public health measures are critical in controlling this pandemic. So when you're indoors amongst people who are not your close household contacts, please wear a mask. We know COVID is spread by droplets and aerosol. Masks protect the wearer. Masks protect the wearer, as well as those in close contact with the person wearing a mask.
Now, it's hard to make sense of what Ranking Member Gary Peters is going on about. To discuss this further, I had a chance to talk to Dr. Pierre Kory by phone on Thursday, and here is how that went.
Dr. Kory, Gary Peters claimed that the doctors were picked for their political and not their medical views. How do you feel about that?
Well, you saw that I was disappointed in that, probably for two reasons. Is that it was a little bit of a shock to me because I don't have I do not mix politics and science. Period. I would never. Number one. What's doubly disappointing is I'm actually a Democrat, a lifelong Democrat, and so I was unfortunate that my own party viewed me negatively. I don't know that he thought of me personally. I think he just assumed. I think he made the assumption that hearing was going to have, I don't know what they call it, alternative scientific theories or whatnot. And listen, medicine has a lot of diversity in it. There's very few scientific truths that are roundly agreed upon, right? And we're learning so much as we go that I think it's an unfortunate view of that of what that hearing was, because it was, I thought, an excellent exchange of ideas. It was an excellent exchange of new findings, new data, really encouraging new data. And so, it was unfortunate that they didn't participate. So I'm disappointed, but I got over it.
Now to add to this, and I'd like to get to your response on this, when he said that, he also then went on to claim that the group of doctors, you, Dr. Ryder, and others, have harmful inflammatory statements that you guys were going to be making, and undermining the vaccine, promoting unproven therapeutics, discouraging common sense measures like social distancing and masks. How do you respond to that?
Yeah, so that was very unfair. I mean, he made a lot of assumptions, and that was very. I don't know if combative is the right word, but it was. I was a bit shocked, and that's why I began my my testimony with registering my offense, because I thought it was offensive and presumptuous. That was an action he took, and I wish he hadn't done it. But like I said, alternatively, it ended up being a very good hearing. I thought people presented a fair reading of the evidence. I was, myself and my group were so appreciative of the opportunity to bring together our data. And in fact, very much in contradiction to Senator Peters, what we actually brought was really sound and large amounts of data that we weren't trying to discredit any. In fact, we were asking for partnership. We were saying, please help us. We would like you to review our data, what we found, so that we can see if we can provide. Now, if they don't agree with our data and that we don't get the recommendation we want, I think we'll accept it. We would be shocked if it doesn't happen. Adrian, the amount of data that we are sitting on that are so consistent and remarkably positive in favor of the efficacy of ivermectin in this disease is pretty much inarguable. I mean, it's beyond the preponderance of the evidence. It's the near totality of the evidence that we have right now. So, we weren't coming in touting or promoting anything. We really just wanted the opportunity to call attention to data, and I don't think Senator Peters understood that. I hope he understands that now, and hopefully he has a more favorable view of what occurred in that hearing.
Now, TrialSite News is reaching out to Senator Gary Peters for comment, and we'll let you know if he responds back to perhaps explain himself. So to wrap all of this up, astoundingly, as we have chronicled ivermectin-based studies for nearly 8 months now, we have shared with the world the accumulating evidence that national research agencies should at least sponsor a study. There is sufficient evidence to do so now, but the disdain exhibited towards physicians such as Dr. Jean-Jacques Ryder and Dr. Pierre Kory, both medical professionals that we here at TrialSite News have interviewed and have covered what they've done so far, was not only unfortunate, but frankly alarming. How can dedicated physicians who are simply committed to treating patients earlier to save more lives be so under fire? Given the growing evidence for the use of ivermectin, which you can find a plethora of articles on at our website at TrialSiteNews.com, why is there such resistance to an FDA-approved drug use off-label if there is so much accumulating positive data? Food for thought. From TrialSite News, I'm Adrian, and this has been an episode of Beyond the Roundup. We'll see you all next time.